Welcome to the Pathways to Success. I'm Julian Placino, recruiting professional turned success speaker, show host, and media entrepreneur. This show is dedicated to helping you find your unique pathway to success by having conversations that educate, inspire, and transform. Together, we'll interview some of the world's greatest leaders and uncover their secrets to success. Thanks for tuning in, and on to the show. Welcome to episode 207 of the Pathways to Success, where we have conversations with inspiring leaders about their business and journeys to success. I'm Julian Placino, your host, and we have an outstanding show for you today. Today's episode is brought to you by Code Up, the premier technology career accelerator in Texas. Code Up specializes in teaching web development, data science, system administration, and cybersecurity. For more information on Code Up's comprehensive acceleration programs, visit codeup.com. That's CODEUP.com. I am very excited to welcome our featured guest, Dr. Kyle Hoedebecke, Chief Medical Officer at Covimro. Dr. Kyle, welcome to the Pathways to Success. How are you, sir?
Awesome, Julian. Thank you for having me here. I'm doing great today.
And I have been very much anticipating this conversation because of the nature of what you do and the potential impact in the world. So I'd like to jump straight into things.
Let's do it.
So Dr. Kyle, you are the Chief Medical Officer at Covimro. What is Covimro?
Great question. So Covimro is, simply put, an antiviral agnostic solution to take out any virus with zero side effects.
With So this is one of those things where I heard the purpose and the mission statement, any virus, including COVID, HIV, influenza, and zero side effects. So one of the things was like, wow, is this absolutely true? So how did this company come into existence? What is the genesis story behind it?
It's a really interesting story. So let's all put ourselves back a couple years ago. COVID is, just starting to move out of China, come into the U.S., move across the world, and really just take over. People are panicked. They're staying home. Schools are closing. Businesses are closing. Stock market's dropping. That's really the genesis of where this came from. So the CEO, his name's James. Mm-hmm. I come from a medical background. He comes from a little bit different background. He's an engineer by trade. So he thought of this from an engineering perspective, whereas a lot of scientists and physicians and people just in my community, we think one way, okay, yeah, we tend to go after these protein spikes. Let's just do it again for this. And that's kind of what has happened with the vaccines, and we see where we currently are at this point. However, our company kind of took it from a little bit different perspective. Okay, well, what is a virus made out of? So it's only a couple of different parts. You have your material on the inside. For most viruses, you'll have a sphere or an envelope, and then they have those protein spikes. So those protein spikes are what are changing all the time, right? So we hear about, the South African variant, Brazilian variant, now the Delta variant. Why are we going after a moving target? So we said, let's go after this sphere, the envelope that doesn't change. And we didn't go at it from a medical perspective. Rather than that, we used an engineering perspective. Okay, well, what is it made out of? How can we get this sphere to come apart, to dissolve, to disintegrate, so that this virus is no longer able to reproduce? So that is how this company came about, really thinking from an engineering standpoint, from the physical properties of a virus and how we could take advantage of those using things that are already out there that have been already generally deemed as safe.
So what exactly is the product? Is it a pill? How is it administered? What is the product behind Covimro?
Gotcha. Great question. So it's a combination of a couple different molecules. I'll concentrate on the main molecule called Covimro 1 at this point. So Covimro 1 can be taken orally or nasally. We're also looking at other applications, so you could use it on your hand like an antiviral. You can use it in soap as a lozenge, which I have currently right now because I just had COVID, believe it or not. But the main purpose of this is to either take it orally or nasally, which is the main routes for, at this point, COVID and how upper respiratory or GI viruses really enter and attack the body as their access point. So it has a couple of different mechanisms of action. One is to really coat those surfaces so that, let's just say COVID-19, we walk by somebody with COVID-19, we breathe in the air, either through our mouth, through our nose. COVID is attached to by the Covimro molecule, and literally what it does is it takes the ball that is COVID and it takes a little bite out of that envelope. Once it takes a little bite out, we've now destabilized that envelope and it just disintegrates.
Okay. So it sounds like there's different kinds of applications and form factors of what the product can sort of become. So does it work? Like, what is the data behind the claims that you're making with Covimro?
I'll hit that from two different aspects. Since we're making two claims, first we're saying antivirus, and then second we're saying no side effects. So let's hit the antivirus part. So I mentioned how Covimro 1 takes apart viruses that have envelopes, but not all viruses have envelopes. Some just have other structures. So we have actually 4 specific molecules within our cocktail. 2 of those attack the actual structure of any virus with that's a caveat part, with the envelope. The other 2 components boost our immune system in reaction to viruses, and that is where the antivirus comes in. The second part of the claim is the 0 side effects. So these are not novel products in that they have been around for decades. They're already considered at this point GRAS, so generally recognized as safe. So these are things that you or anybody in here or anybody watching probably ate today, but not for the purpose of fighting COVID or any other virus. You ate it for another purpose that it has previously been used for. So we've been able to take those things that have been already considered safe, that are in everyday foods you get at the supermarket, but reformulate and rearrange how we're using those so as to fight viruses.
So what is the actual data? What have you seen that is working to allow you to make such powerful claims?
Great question. So right now, we have evidence both in vitro and in vivo, breaking that down: in vitro in like the lab in test tubes, and then in vivo in actual live animals. So we have this data against 3 viruses right now. So started off just with COVID-19. So in Leeds University out of the UK, we've shown that in the lab we're able to have up to a 5 log reduction, which is about the same as floor cleaner or bleach. And something
and what does that mean, log reduction?
Yeah, so that is a very high level of reduction from a high number of viruses present to nearly 0, nearly undetectable. So that's what that means, is to a level that's undetectable. We followed that study up, so that was with COVID-19. Followed that study up with lentivirus, which is HIV, and that was out of Oxford University. And again, another reduction, 3 to 5 log reduction, again, looking at different both quantities and concentrations of Covimro against HIV. I think you have an image I provided. I don't know if you want to do that now or later.
Yeah, sure. Derek, could we tee that up? It looks like it's actually up already. Okay. Yeah, if you could speak to that as far as what exactly are we looking at, and kind of further explain that for us so we could understand.
Yeah, sure thing. So as you see here, there are several different spikes on the graph. We have the x-axis, which is the bottom part of the graph going from left to right, and then the y-axis is going from top to bottom. And then you also see that there is a legend there looking at Covimro at different pHs, as well as, sorry, I'm just moving over here so I could actually see the entirety myself as well as in different media and water as well. There we go, great. So there's like a dark blue, just a normal royal blue, a mustard, and a lime green. The first spike on each of those colors is the level of virus, so lentivirus, so HIV, without any Covimro. And then again, we're looking at it under different conditions, because when we get sick, it's under different conditions as well, right? As we add higher concentrations of Covimro, you can really see how that lentivirus quantity is just dropping from the baseline. You can see that there are also on the right side of the graph different log reductions. So again, I will give you kind of an understanding. A 3 log reduction is pretty darn good for a pharmaceutical, for a medicine. A 5 log reduction is basically like a floor cleaner or some sort of industrial detergent. So you can see that as we go across the graph for each of those media, we really drop down the level of lentivirus, HIV, to a 5 log reduction. So at the same level of an industrial floor cleaner, as an example. That's pretty incredible, and something that is safe as a strawberry milkshake.
And over how many tests to be able to produce this data, would you say?
How many tests?
Yeah.
So this was done a handful of different times within Oxford to make sure that there was reproducibility. But as far as once we had our product, there was no failure. This was the first go, and those were our results.
So is Covimro a cure? Is it a preventative? Like, how do you position that in the everyday consumer's mind?
So there's a couple things. So I'll first off say it's not a vaccine.
Okay.
We, our formal stance is we support vaccines and any evidence-based medicine out there. We're behind that. That being said, we do recognize that up to 30 to 45% of populations here in the U.S. and abroad are not willing to take vaccines for one reason or another, and more power to them. That's your right as an individual. So we're still wanting to protect those people. We have people who cannot take vaccines. They're either immunocompromised or have a negative reaction to vaccines previously, like prophylaxis. So they can't. It makes them stop breathing. So those people can't take it. And then we just have billions of people around the world who still don't have access to vaccines. We're very lucky here that we do, but around the world it's not necessarily the same where they do have this access. So these are people we still want to protect against COVID-19 as well as whatever the next future outbreak is. So how do we position that? To get back to your question. So I see this both as prophylactic as well as it can be a treatment as well. So prophylaxis, meaning just prevention. So I am going on maybe going on a flight tomorrow. I'm not really going on a flight, but let's say I'm going on a flight tomorrow, and I'm scared because it's a high-risk situation. Lots of people are going through there. I can take Covimro prophylactically to prevent any sort of infection on the viral side from occurring during that flight. It's good for about 8 to 12 hours. Mm-hmm. Also, if I get, let's say, I didn't take it and I ended up getting COVID-19. So you could still take this and help. It's not going to make the infection go away, mm-hmm. but it will reduce the viral load. And the science has shown if you can reduce the viral load, it gives your body and your innate internal immune system time to rev up and really fight the virus. That's the gold standards. That's literally what a vaccine is doing, is exposing you and then to something that is similar to COVID-19, mm-hmm. and then you're allowing your body to make a response, a fighting response for that immune response. So if we can keep those virus levels down within the body, rather than them being really high, which is connected with going to like the ICU or having a really bad severe case, mm-hmm. We're really allowing people to have a fighting chance to stay out of the ICU, stay off the ventilator, and recuperate with your innate immune system.
So if somebody has HIV and they take Covimro, what happens then?
So we're switching from COVID-19 to HIV. So that is a good question with HIV. So it's at this point we don't have any evidence saying that it's not a cure for HIV. We'll put that out there. It's not a cure, but we can with the evidence we have. We still need to get more data, but it looks like we can really prevent transmission of HIV from someone who has HIV and maybe exposes somebody, or has the potential to expose somebody else, mm-hmm. and then somebody who wants to reduce their viral load. we could assist with that as well, again, pending additional studies to prove that.
Yeah, I guess where my mind was going, because it said any virus, right? And I understood the preventative piece of things, but if somebody already has the virus, what does it do? And it sounds like you mentioned that it sort of decreases the viral load and
Yes.
also gives it less chance of perpetuating. Is that correct?
Correct.
Of spreading. Okay.
Exactly. So if it attaches to HIV, COVID, influenza, which we haven't touched on yet, but have evidence against, it breaks that apart. Exactly. So that specific virus is no longer able to infect you and infect your cell. And each cell is different for each virus, but each cell can send off thousands of new viruses from hundreds to thousands, depending on which virus we're talking about.
So how is this different than perhaps some other solutions on the market right now? What is kind of uniquely different about how Covimro is going about this issue?
Great. So it's completely different than, the big question we always get is, how is this different than a vaccine? So the vaccines, again, are going after those spikes that are coming out of the ball. So the ball and the spikes, they're going after that moving target. So that in itself is completely different than what we're doing. And efficacy-wise is also quite, questionable. I'm vaccinated and I still got COVID-19, and we're seeing that over and over again as we get farther away from the original COVID-19. So that's worrisome in and of itself. Other things are other antivirals as well, aimed at COVID-19 or aimed at even other, we're talking about different viruses, one called RSV, respiratory virus for kids, pneumonia vaccine, there are hepatitis C vaccines. So I'm just thinking of different vaccines that, not just vaccines, but treatments and cures that are out there. They are not based on natural, in general, not based on natural, already proven safe compounds out there, and we are. And those are pharmaceutical, so a lot of these are artificially created, and we're a nutraceutical, so we have a medicinal purpose, but we're based on, and are, not based on, we are naturally and already safe things that are out there.
So what is the lasting message you want our audience to get as far as the product goes? Covimro is a what? This will benefit you how?
So Covimro is a safe, over-the-counter, natural, cost-effective way to not only limit your exposure and infection from viruses, but really allows you to get on with life and live it to the fullest. So that's what we're here to do.
I love that. And Dr. Kyle, I know you are actively looking for investors for Covimro, is that correct?
That is correct.
So address the audience who may be interested in something like this. What is in the opportunity? What is the benefit to them from an investment standpoint?
Great. So as we develop these, continue to show efficacy, continue to show, improve our safety profiles, as we are developing this, bottling it, sending it around the world, that comes with costs. It comes with different levels of people we need to hire as far as a team. It doesn't just happen by itself. So currently looking for investors who are interested in really changing how we fight not only COVID-19, but really any virus, and preparing ourselves for that next viral outbreak. So this one caught us off guard, yes. So we need to learn from this and be prepared, and we're here to do that. So we're currently raising, and we're based out of the UK, but have also just recently incorporated here in the US. So in pounds, we're raising 2.5 to 3 million pounds, which is about $3.5 to 4 million US dollars for 10% of the company. And we did have the company independently reviewed and valued, and that came in at a 35 million pound, not dollars, about a 42 million dollar valuation. And we're making sure that we ask for valuation less than that, because one, we want to make sure that people see how good of an opportunity it is, and we really want to bring on the right investors as well. So anyone who's interested from an investment standpoint, as well as anyone looking to collaborate, this is a call to action for you, and we're really looking for those people who can help take this to the next level.
So, Dr. Cal, one of my favorite shows is Shark Tank, right? And I know for a fact that there are sometimes ideal investor profiles that match a particular company. Who would you describe as your ideal investor?
My ideal investor would be someone who has the capacity, ideally, for a 6-figure or higher investment, someone who's able to provide either insight or value through distribution, through bottling, through connections as well, networking as well. Those type of strong and smart investors would be really ideal. Again, anyone who's really looking to change the way we're dealing with these viruses would really be welcome to come on board at that point and see if it's a good fit for the team.
And before we take our commercial break, tell us why now is the perfect opportunity to get involved.
So now is a great time to get involved. From the where we are in the world, things are going pretty well. So there's probably going to be, I'm not a stock market expert, but they're going pretty well. Eventually, got to go back down sometime. So it's a good time to use those funds accordingly and get involved in something that is really we're asking an undervaluation level for this company. And then again, from the scientific aspect, it's really ideal because we're showing that what we're doing now is not the answer that we were hoping that it would be. So I think anybody pro or against vaccine can say, yeah, the vaccine is not working as well as we hoped it would be. So we do need that next solution, and we're right there to be that next solution for this COVID-19 as well as the next upper respiratory pandemic, whatever that may be.
And tell our audience how to learn more about the investment opportunity and connect with you about this.
Awesome. Yes. So yeah, feel free to reach out to me personally. My personal email is Hodebeck. That's a hard last name, so it's KHOEDEBECKE@gmail.com. You can also look for us online. Covimro is spelled C-O-V. I'm messing it up now. C-O-V-M.
C-O-V-I-M-R-O.
There you go. I can't even speak anymore. Sorry. Camera fright. Sorry about that. Covimro.com would be great. There's a 5-minute video online that really explains for the basic from the beginning to really, I guess, the intermediate level understanding of science. It kind of breaks that down. If you want a more in-depth, higher level of the science, happy to discuss with those folks as well. So again, thank you.
Okay, and we'll have to make sure all of that contact information is in the show notes as well. So now, Dr. Cal, we're going to take a quick commercial break to hear from our sponsor.
You want to transition out of your career and do something tech-related. Hodebeck is the place for you. When I came to Hodebeck, I was actually working at a chain hair salon. It was just starting not to be for me anymore. My goals were to never work a weekend ever again, to have full health care and benefits, and to just have more time with my son. And now I've met all of those goals. I don't have any regrets. I just regret not coming sooner when I saw those billboards when I was driving down the highway. You want to transition out of your career and do something tech-related. Hodebeck is the place for you. When I came to Hodebeck, I was actually working at a chain hair salon. It was just starting not to be for me anymore. My goals were to never work a weekend ever again, to have full health care and benefits, and to just have more time with my son. And now I've met all of those goals. I don't have any regrets. I just regret not coming sooner when I saw those billboards when I was driving down the highway. Want to transition out of your career and do something tech-related. Hodebeck is the place for you. When I came to Hodebeck, I was actually working at a chain hair salon. It was just starting not to be for me anymore. My goals were to never work a weekend ever again, to have full health care and benefits, and to just have more time with my son. And now I've met all of those goals. I don't have any regrets. I just regret not coming sooner when I saw those billboards when I was driving down the highway.
And we're back with Dr. Kyle Hodebeck, Chief Medical Officer at Covimro. Sorry for the commercial ad rolls there. We actually had some interesting technical difficulties, but I think we're good to go now. The beauty of a live show, so thank you very much for bearing with us. So, Dr. Kyle, this show is all about really giving back to our audience the pathways to success. How did someone become successful, and what can we learn about their journey? So I'm going to read this because I want to edify you properly. You are a certified physician executive with 20 years of leadership experience, a fellow of the American Academy of Family Physicians, and you have over 75 peer-reviewed publications across 5 continents in 8 languages. You have mentored medical professionals in over 120 countries. You speak 4 languages. You blew me away at dinner that night. Kyle, you serve as a senator of the World Business Angel Investment Forum, where you represent the United States, and your work has been recognized by leaders across the business world. So regardless to say, you've had an incredible career. The keys to success that you wanted to share today, the first one you wanted to mention was this idea of sharing the wealth. What does this mean?
So sharing the wealth, when I was an undergrad in medical school, you have those people that are, we call them, gunners, getting over COVID. Called gunners. So those people that are really just out for themselves, and they'll throw anyone under the bus to get on top. And you probably know people like that in your business as well. So I've found that although those people might have moderate levels of success, usually in the short term, because eventually that comes to bite them, in the rear, bringing people along with you really may take a little bit slower, but it gets you a lot farther and a lot longer and a lot higher. So I've found that building leaders and giving back in different, it could be many different ways, but really giving back at a level where, it might not help you, but it helps somebody else. And because they see that, they're willing to help you and pay it back as well. Or you get that rapport, that bond with that person. So I've learned, especially in my time in the military, time with startups, if you're willing to give that, that little extra attention to people who really need it, they'll work that much harder for you and make you that much successful. So that's mainly what I mean by ensuring that you give it back.
What's one thing that our audience could do? And again, we have business owners, corporate executives, CEOs, corporate professionals wanting to really advance their career and grow as leaders. What's one piece of advice that they could take action on to grow in that regard?
I would take a quick moment anytime during the day when you're coming across, especially as we get back into the office now, to talk to your fellow colleagues, even if they're not in your team, they may be on another team, and learn a little bit about him or her. Do they have kids? Do they have family? What are their aspirations, both personally and at work? You can keep those in your brain, and then when something happens that kind of triggers that, oh, Johnny said that he was really interested in working on this type of project. You know what? I'm going to go get Johnny involved in this. And that's really one way that you can give it back. Understand what values and what aspirations your team have and help them achieve those.
I love that. I think that's great advice. The second key to success is the way that you deploy your energy and also time management. What's the best advice you could give us on that?
So that is great. I was fortunate enough to graduate from the U.S. Military Academy, and a lot of people ask, what's the one thing that you feel you learned from that as well as your military experience? And they expect things like shooting a gun or learning how to do X, Y, and Z. But for me, really, it's just learning how to use time optimally, to time management, to tell you the truth. So it's an engineering school, and knowing that I was kind of going the medical route, I said, what's the easiest engineering course I could take? That's literally my words, and it was systems engineering. Little did I know that would actually be as important as my clinical skill as I became a leader within medicine. So I even take that beyond medicine and like anything in life. So if you can set up systems so that you don't have to think about little things throughout the day, it saves your brain power for those big decisions. You only have a certain amount of decisions that you can really make well and efficiently throughout the day. So don't waste it on stupid things like, I don't know, what am I going to wear today? What am I going to have for breakfast? Like, have those things kind of lined out. If you can plan out, you know, your schedule of food, if you can plan out your schedule of what you're wearing, et cetera, save that brain power for things that are really important. That would be my 2 cents.
What would you say has been the most impactful system that you personally have implemented over the last 3 years?
Last 3 years. Great question. So I am very big into like Lean Six Sigma. So really making things as efficient, cutting off fat, and going as quick from point A to point B as possible. So I had the pleasure of leading soldiers and that were working in 4 clinics in the military, and this was just right at the 3-year kind of time frame you mentioned. And we were able to get that buy-in from the team and change how we managed our systems, how we provided care. Not the care itself, we still provided great clinical care, but everything in between, how the patients move throughout the clinic, for example. By doing that, we were able to get more patients through, patients were happier, got better care, and everyone that was involved was really happy. So that was just an example of getting that buy-in, making tweaks to how something's quote-unquote always been done, which is some of the scariest language I ever heard. Why do you do it that way? Because it's always been done? It's not a good answer. So finding those ways, and also getting that buy-in from your team. So you're not telling them what to do, they're telling you what to do.
That is great advice. So the final key to success here you mentioned is to learn always, and that I think it can sort of be dismissed perhaps as a platitude, right? But what's the deeper meaning behind that? Why is that something you're passionate about speaking on?
So I've studied 1 or 2 things in my day, as you can see. So I put my money where my mouth is. But one of my philosophies is to live today like you'll die tomorrow, learn like you never will. Meaning, learn like you'll never die. Like, you always are going to be there. You always need to learn. You always need to improve. There was a funny saying in medical school. They said, I remember the very first day, they said, students, half of what you learn here in the next 4 years is wrong. You have to figure out which half that is. So by stopping learning, if you assume that's right, stopping learning, and just in medicine in particular, means that I'm practicing medicine all wrong down the line. So I need to continue to learn to make sure I can fill in that gap, and that's just specific to the clinical side. As a business person, you need to be reading, you need to be going to seminars, you need to be listening to experts in their field to see how they got to where they are. Bring them in as mentors if you can, and just really always push yourself to be a better you.
I love that. Dr. Khan, I'd like to close with a few kind of fun questions just to get to know you and your personality, what you're like as a human being. So I want to kind of wrap things up by just learning more about you. So, Dr. Khan, what's your favorite food?
Ooh, favorite food. This is going, so me not being healthy, my favorite food would probably have to be like steak on the grill, probably like
That's right, man. That Brazilian steakhouse, that was awesome.
We had dinner. We had so I was fortunate enough to spend a lot of time in Latin America, Brazil, Argentina, Paraguay, and they really take steak to an art form. So when it's done like that, that's, I think, probably my favorite food.
What kind of music are you listening to lately?
So I use music not only to kind of relax, but I also use it as a learning tool. So I'm working, I like languages, so I'm working on a couple languages right now. So I have a good amount of music in Italian as well as in French right now, just to get that ear for it, and then I also practice and get the tongue for it as well.
What is something about you that when people learn, they find it highly unusual and surprising?
If I just meet someone on the street and just talking, and they eventually find out I'm a doctor, they say, you do not look or come across as a doctor. So I get that a lot. And then what else? And then I guess, the language skills as well, when I can really just switch into different languages fluently. People don't expect that from an American in general. We're famous for speaking one language.
When I first met you, I thought you were a fighter. You know, I didn't think that you were like a doctor. So, and also it's like you're so humble about your awesomeness, and I just really appreciate that about you, Kyle. So, final question here for you. The show is called The Pathways to Success. What is your personal definition of what success is?
So for me, it's going to be different than each of you out there, but for me, and what I want to do before I leave this world is to improve our healthcare systems here in the U.S. and abroad through improved technology and systems. So that's success for me.
Awesome. Dr. Kyle, this has been absolutely incredible. The work that you are doing and Covimro is doing is absolutely amazing. If you would, one more time, tell our audience how to connect with you, follow you, and all that.
Sure. So again, thank you all for your time. You can find me online, Kyle Hoedebecke, K-Y-L-E, last name is a little hard, H-O-E-D-E-B-E-C-K-E, on LinkedIn, on Twitter, and whatever other social media is out there. We'll probably soon be on there as well. But I really thank you for your time. Feel free to reach out to me on those social media platforms and beyond for anything you're interested in. I look forward to collaborating.
Awesome. Dr. Kyle, it's absolutely been a pleasure to have you on the show. Thank you for being here.
Thank you.
And everyone else, thank you all for tuning in to another episode of The Pathways to Success. As always, make sure to subscribe, comment, and share. And we'll see you next time on the next episode of The Pathways to Success.